Good morning, everyone. This is Seela with Wholefamilymedicine, and I am here today to announce the news that I feel like pertussis, or whooping cough, which is a vaccine preventable disease, is made it to our community in the Asheville area of Western North Carolina. So I'm going to take a little time today to talk to you all about incubation periods and contagion periods and what to expect in the disease and how to treat it both with standard Western therapy and holistic anthroposophic therapy and why we might choose to do that. Okay? So first of all, you're probably wondering, like, how do you get it? How long does it last? What do you expect? Of course, everyone, when they think about whooping cough, they think about a highly spasmodic cough where the child is coughing and coughing and coughing and coughing until they have to take a breath, and it's like, and then they're coughing and coughing and coughing. It's a really scary thing for parents who don't know the greater context of what's going on to witness. Okay, and we're very much educated by Western medicine to just be vaccinated and then treat prophylactically with antibiotics and then treat with antibiotics for the actual reception of the disease process. But there are other options that we have, but it is not my job to tell you what to do. It's just my job to offer lots of education, which is what we always do at Whole Family Medicine. So first of all, there is about a 1 to 2 week incubation period with pertussis. So what does that mean? You saw your friend at the skating rink and you slapped him a high five every time you were roller skating by them. And then the next day you find out, oh, that little snotty nose that he had, well, it's turned into a cough, and it's turned into something that looks like whooping cough. Mama took Johnny to the urgent care. It got diagnosed, and now you know that you've been exposed. So you can expect to see the first symptoms in 1 to 2 weeks from the event at the skating rink, okay? Now, what happens first? We see something that appears in a catarrh-like fashion. So catarrh is inflammation, swelling, and discharge, typically of the nose, but also of the chest. So you're going to see what we would commonly think of as a kind of like snotty, stuffy nose. Maybe it's going to turn into a sinus infection. Maybe it's going to turn into an ear infection, and a deep chest cough with lots of rattly, junky stuff moving around in there. You might call it a bronchitis, okay? Then that is the most contagious period before that classic whooping cough, spasmodic coughing starts to happen, okay? So after that period also lasts for about 1 to 2 weeks. So once you get the catarrh, you can experience that for 1 to 2 weeks, and then the convulsive coughing attacks start, okay? This part, not so contagious. The catarrhal period, more contagious. And that's tricky, right? Because no one would necessarily know that that was whooping cough unless you knew that you'd been exposed to someone who had whooping cough and you were waiting for it and you knew it's on its way. And that spasmodic coughing is actually a result of the toxins that are formed from the bacteria that creates whooping cough. Okay, so just like in strep throat, we have toxins that are developed that create scarlet fever, which is the rash associated with strep throat. It's the same thing. It's not that the rash is the illness or that the spasmodic cough is actually the illness. It's the byproduct of the toxins that are creating pertussis. Okay. Okay. So who are our highest risk populations? Okay. Our highest risk populations are infants less than 4 months and children who might have complications of the brain, the lungs, or the heart. And in anthroposophic medicine, when we'll talk about this more, the lungs and the heart are the rhythmic system. And they are the mediators between our consciousness pole and our digestive pole. I'm pointing down to my abdomen down here where we do all our digestion, okay? So when someone's really in harmony with their, with imbalance between their nerve sense pole and their metabolic pole, the rhythmic system is really healthy. It's like they're breathing in, they're experiencing a thought, they're breathing out, they're going down to the metabolism, which is connected to the limbs, they're taking rightful action, they have breathed in, they take another thought. So this process is what it looks like in harmony. Okay, so again, back to where we were, we're talking about people who are high at risk. So also children who are at risk for apnea, okay? And it's really important to know that children under the age of 4 months actually are at higher risk for apnea, which is what I wanted to say, and certain organ diseases, because that toxin that causes the spasmodic coughing also can damage the lining to the lining in the airways to a very small baby. They're still so fresh and so new, right? Okay. So I also want to note that whooping cough does not cause otitis media, which is an internal ear infection. It also does not cause bronchitis. Those things are secondary to the whooping cough. So they are caused by the whooping cough, just in case you were wondering. Okay. Now I want to talk about, well, actually, let me move forward and just talk about what the treatment might be. So if you know that you were exposed to someone with whooping cough and you go to your Western provider, you're typically going to hear, okay, we're going to give you a macrolide, which is either azithromycin, erythromycin, or clarithromycin. Okay. You're also going to be giving these different agents, and this is adults, this is children, this is infants. The provider is going to decide on the specific agent of choice based on your risk factors and your age and other things like that. So if I'm that provider that you're coming to get an antibiotic from, which is totally fine, you know I'm always going to meet you where you're at. We're going to look at the most recent up-to-date information and decide which antibiotic to give you, whether it's for prophylaxis or sort of shortening the course and the severity of the disease. Okay. You also can get vaccinated for pertussis if that is what you want. You know me, I'm always going to support your decision, however you want it to be. And I'm always going to also give you the natural choices as well. Okay. So that's what we're going to do. Again, it's more indicated for children, infants under 4 months of age, or people at risk for apnea, and children with heart, lung, or airway and brain diseases would be the people who are going to be most likely to want to take a preventative agent via antibiotics. Although we also have homeopathic agents that can be used and have been used successfully, mostly in Europe, because they tend to do those things like that there. Okay, now I want to talk about what whooping cough can offer your child and why it is an opportunity for growth and development. Okay, so anthroposophic perspective on this is that children who have a tendency to have a separation of their head pole from their body tend to contract whooping cough more than other children. Okay, so what does that look like? What do I mean by that? This is a child who lives in their head more. This is a child who might experience more anxiety, might be sensitive to the feelings and experiences of other people. We might say their field is open, okay? These are also children who are restless, nervous. They might be finicky eaters. They might have a tendency towards stomach pains. They might have a tendency towards stagnation and swelling in the head pole, the lymph, the tonsils, the neck, and the adenoids up here. Okay, so all that lymph tissue might have a tendency to swell. Also, in older children, we might see more headaches. Okay, so this is the kind of child. The way that we look at this in anthroposophic medicine is that this is the kind of child who has not made their body their home yet. And we talk about this a lot in the practice, but just to for those of you who are unfamiliar with this idea, during the first 7 years of life, through fever, through play, through movement, we take the inherited body that we receive from our parents and we make it our own. It's remodeled through warmth and inflammation. And that's why we are really supportive of allowing children to have fevers without using fever reducers, because this is really about the integration of the soul and the spirit into the physical body for the rest of their lives. Okay, so you all, adults know plenty of people who are anxious, have trouble feeling into their body, they live more in their head. We don't want that for our children. We want a fully integrated, balanced, and aligned human being to be walking on this earth, understanding and receiving their direction and guidance from their God, their higher power, however you see it, being in communication with their angels and ancestors about what to do, so they're not confused or disoriented. They know what they're doing in this life, and they are living a life of purpose, and they are thriving. And this is what we want for all people. So we definitely want this for our children. So those children, especially those children who are after age 7, but even those who are before, who are showing these tendencies, we want to allow them to have this process if at all possible. Now, mom and dad, you have to understand that this is a little bit of a separation and an independence gesture away from you. Doesn't mean they're ready to go to college yet. It just means that they're ready to take that physical body that you gave them and make it their own. So your trust and faith in this process is so important, that you don't become so fearful that you hold them and cloister them. You allow them to breathe. You allow them to have these coughing processes. And we're going to talk about remedies that you can use to support this process. And we can even get you some remedies for your anxiety about the process that's going on. But what I really want to say is that a child who has lived in their head, been more anxious, been more finicky, had more belly aches, been a picky eater, low appetite, has the possibility of going through this illness and on the other side, more clear language development, especially if they were stuttering beforehand, a change in appetite, a sense of emotional peace, and generally the feeling that they are more at home in their body. That is what we could expect if we allow this disease process to fully run its course, okay? So what are some of the tools that we have? So Anthroposophic Medicine has given us some really wonderful guidance on the tools that we have for whooping cough. First of all, if we want to do a homeopathic prophylaxis, Drosera in dilution 30, 5 pellets one time, or Pertussis in dilution 30, 5 pellets one time. I do not have these remedies in my office. We can talk about getting them. We can probably order them from Europe. There might be an American supplier of these higher potency Drosera and Pertussis. This would be a one-time dose as prevention. Not a bad idea for all of us, as we are probably going to encounter pertussis out in the world. Okay, for children that are at risk, for parents who choose to not use an antibiotic prophylactics, we could use, and children who are at risk for apnea, we could use Pertussis stibiatus, a D6. That would be 5 drops 5 times daily through the course of the exposure. Also, in a child who's open to it, a subcutaneous injection of 0.5 milliliters of echinacea D3 could also be a way to go about this. General treatment for pertussis for those children who are over 4 months of age, not at risk for heart, lung, or brain conditions, we're going to give them cupramaceticum 3 to 6 times a day, 3 to 5 drops. We'll also give them Drosera comp. Okay, that's another remedy we can give them. And usually with these two remedies, we're alternating cupramaceticum, Drosera comp, like every hour. If we're giving each one, 3 to 6 times daily, then we're going to be alternating every hour or so a couple drops of a liquid form of cupramaceticum and Drosera from Uriel. Okay, if they're less than 6 months of age, Pertussis stibiatus is actually indicated rather than cuprum and Drosera. Okay, so if the baby's less than 6 months, we're going to use a different remedy from Uriel. We also have specific treatments if the mucus is thick and stringy and fits are in the early AM. If they're vomiting a lot, we can use Ipicanium. It's the Ipecac, right? It's the homeopathic Ipecac. Anyway, belladonna or arnica for reddening of the face. Bryonia for painful coughing, weakness in older children, Pertussis stibiatus. If a child has a poor condition, even if it's a cough that's really not that bad, but the disease process feels stagnant, we can use Formica. It's highly excretory. Okay, and then I just want to talk. So that's kind of like all the remedies. You definitely need to work with a provider, and you want to work with an anthroposophic provider if you're following these protocols. So I'm definitely a person that you could link up with to do that work. There's also other homeopaths in the community. Of course, your Western doctor can prescribe the antibiotics needed. But I just want to talk about general care, and it's specifically important because this is an illness where your child really has an awesome opportunity. So we want to make sure that we carry them through and we support them all the way through. So with any remedies we're going to continue to use them probably a week after all signs are clear, to make sure that we don't have a relapse. We also want to make sure that the child is warm at all times. We don't want to have a war with our children, but keeping them warm is going to help the body process the toxic material and the process of coughing much easier. We also want to make sure that we're really careful with promoting and offering easy to digest foods to the child, because there's something about whooping cough where once that whooping cough state starts, that spasmodic attack, it's as if the child is trying to expel anything alien to them. So if their digestion is, if the forces of digestion have been diverted to the healing process and their digestive forces are not that strong, and then we give them heavy foods, lots of proteins and things like that to digest, they are going to struggle with digesting these foods, and they're going to end up vomiting more often. Okay, so what are things that are easy to digest? Well, that's very individual, but specifically raw and cold foods take more digestive fire. So you want to do warm cooked starches. So well cooked rices, sweet potatoes, squash. You can go ahead and add your butter and salt. Okay, we want things that are easy to digest. Stewed fruits like apples. This is kind of like a seasonal thing, right? These are the kind of things we want to eat in the fall anyway. Besides that, we want to increase detoxification. So lots of water, lemon juice, honey, linden infusions, nettle infusions, burdock infusions, dandelion infusions. All of those things are very helpful to the detoxification process. If needed, we can get them a tincture of something that will help detox. And finally, anything that's going to increase their need to process, we want to turn off. So we want to get away from screens. This is not a time to put your child in front of a television when they're sick, okay? We can read them books, we can do book on tape, we can sing to them, we can play cards, we can do restful activities, but we really do need the child to not be getting a lot of extra input. That means, let's really watch our energy around the children. Let's keep things calm and tranquilo, as they say in Costa Rica. Really chill for the children. Okay, nothing extra to digest spiritually, visually, auditorily, and through the mouth. What to say? This is an awesome opportunity. It's scary as a parent. It's like, whoa, what am I going to do if my kids get whooping cough and I'm trying to work? How's this going to go, right? So we all have to make our individual choices about how we want to respond to this opportunity. But if you have a child who specifically is struggling to anchor themselves in their body, if they have ADD, if they have ADHD, if they have autism, if they're anxious, depressed, having stomach problems, having headaches, having digestive disorders, this might be the opportunity, stuttering, language and speech disorders, this might be the opportunity for them to actually fully embody themselves and find some balance and healing in that way. If you need to, use the prophylactic antibiotic. If you need to, use the antibiotic. If you want to, use the homeopathic remedies, use some herbal remedies. I'm sure that there's also, herbal remedies for pertussis. This is just not, my wheelhouse, and I like to offer the anthroposophic perspective because it's so less known. But really remember, this is an opportunity for your child's spirit to grow and expand and to make the beautiful physical body that you gave them, remodel it and make it the most comfortable home for their spirit and soul for the rest of their life. So if you don't know me and you're watching this video, you can reach me at www.wholefamilymedicine.org or reach out to Christine, our nurse, at wholefamilymedicine@gmail.com for purchasing remedies, for getting consultations, for anything that you need. May you all make clear choices. May you all be well. May you all have the support that you need while you're supporting your children and yourself through this process.